It's still one of the most common causes of death in the neonatal intensive care unit. In newborn, sepsis is still defined as a bloodstream infection that causes an inflammatory response by the baby. Yeah, and the mortality, depending on which organism it is, still quite high.
Organism,
the pathogen, the microbes that cause infection, especially in the tiniest babies. They can be normal skin bacteria that in you or I, we all carry them on our skin, but to us, they're pretty harmless. So about 2/3 of the infections we see isolated from the blood of the sick baby, we find these skin bacteria. And then the other third are bacteria that you and I would also fall ill with, and they were typically more serious. So if it's the more serious bacteria, then mortality, the risk of a baby dying is 25-30%. It's quite high. It's still one of the most common causes of death in the neonatal intensive care unit. If it's the skin organisms, usually the risk of dying is lower, but it still carries long-term implications. And we know that survivors of sepsis do have a much higher risk of having long-term developmental problems because of the inflammation that can harm the developing brain.